You've probably seen the term horse trick floating around on social media lately. But what actually is it? And is there any real science behind it when it comes to erectile dysfunction? Let's break it down properly. Just to be clear from the start, this video is for general information only and isn't a substitute for medical advice. Always speak to your GP or a qualified healthcare professional for personalised guidance. So, what is the horse trick? Despite the name, it's not some unusual internet fad. It's essentially a form of pelvic floor muscle training, sometimes called PFMT. The social media name comes from the muscle engagement pattern involved, but clinically, this is a well-established area of research. The technique focuses on two specific muscles at the base of the penis, the bulbocavernosus and ischiocavernosus muscles. These are responsible for maintaining rigidity during an erection. The exercise has two phases. First, you relax the pelvic floor, sometimes called a reverse Kegel, or a gentle push-out sensation. Then you follow that with a controlled contraction, engaging the muscles you'd use to stop urination midstream. That said, it's important to be clear. The midstream analogy is just to help you identify the right muscles. Don't make a habit of actually stopping your urine flow during urination. That's not recommended. Now, does it work? Research suggests that consistent pelvic floor muscle training over 12 weeks or more can improve erectile function in some men with mild to moderate erectile dysfunction. These are findings from randomized controlled trials, which is meaningful. But it's not a guaranteed fix for everyone, and here's why. Erectile dysfunction has multiple causes: blood vessel health, hormonal imbalances, psychological factors, or a combination. Pelvic floor exercises address one piece of that picture. They're not a replacement for a proper assessment or a comprehensive treatment plan. One important caution: if you experience pelvic pain or you think your pelvic floor might already be overly tight, speak to a pelvic health physiotherapist before starting these exercises. Over-recruiting those muscles can actually make things worse in some cases. In the UK, the first-line medical treatment for erectile dysfunction typically involves a class of medicines called PDE5 inhibitors. You may know these as sildenafil or tadalafil. These work by increasing blood flow to the penis during sexual stimulation. They don't work independently of arousal. One critical safety point: PDE5 inhibitors are not suitable for everyone. If you take nitrate medications, commonly prescribed for angina, or use recreational nitrates, sometimes called poppers, combining these with PDE5 inhibitors can cause a dangerous drop in blood pressure. Always be honest with your doctor about every medication and substance you use. So what should you actually do? If you're experiencing erectile dysfunction, the most useful first step is speaking to your GP. Pelvic floor exercises can be part of a broader approach, not a replacement for one. Your doctor can help identify any underlying cause and advise on whether medication, lifestyle changes, or a referral to a specialist is right for you. It's also worth knowing that erectile dysfunction lasting 3 months or more can sometimes be an early indicator of cardiovascular disease or diabetes. That's not said to alarm you. It's said because getting checked is genuinely worthwhile. And 2 situations require urgent help. If you have an erection lasting more than 4 hours, that's called priapism, call 999 or go to A&E immediately. It's a medical emergency. Similarly, if you experience sudden erectile dysfunction alongside chest pain, seek emergency care straight away. For non-urgent concerns, contact your GP or call NHS 111. To recap, the horse trick is a social media name for pelvic floor muscle training, and the underlying science is legitimate. Consistent practice over several weeks may help some men with mild to moderate erectile dysfunction, but ED has multiple possible causes, and these exercises work best as part of a broader plan discussed with a healthcare professional. If this raised questions for you, drop them in the comments. We read everything. And if you found this useful, give it a like and subscribe for more evidence-based health content from Bolt.